Hi, let's talk about the vagus nerve stimulation or VNS for epilepsy. I will talk to the in-depth about this device and the new treatment for epilepsy and answer all the questions that might have even thought of before. And I got lots of questions to answer, so let's go about them one by one. I'm your epilepsy specialized neurologist, Dr. Omar Danoun, and welcome to the Epilepsy Encyclopedia, where you find all the information you need about epilepsy and seizures so that you can take good care of yourself and your loved ones. About a quarter of patients will have what we call drug-resistant epilepsy, when medications will not help to stop the seizures. And in these patients, we will need other treatment modalities, such as surgical treatments and implantation of devices. And today we'll talk about the vagus nerve stimulation part of this treatment. What is vagus nerve stimulation? So vagus nerve stimulation is a device that is implanted around the vagus nerve on the left side in the neck. And there is a wire that goes to a generator or a battery that is implanted under the clavicle on the left side as well. And this device will give electrical discharges or give some small amount of electricity that travels to the brain and help to treat seizures. Who is the best candidate for vagus nerve stimulation or VNS? When we have drug-resistant epilepsy, we try hard to do testing to identify if there is any scar or a cause or a spot in the brain that we can take out surgically, which is the best treatment. But if we have multiple scars or multiple areas of the brain, or we call multifocal, or we could not find that spot in the brain, then we might go to vagus nerve stimulation. The VNS was first approved by the American FDA in 1997, and it is now approved for children 4 years of old and older, and in Europe it is approved for any age. And we have used the device for adults and for children of all the ages, and there are even reported cases of using the VNS for children as young as 6 months of age. The seizure types that works are pretty much all types of seizures. It is best working for the focal epilepsy when there is a spot in the brain that is causing seizures or multifocal seizures, and the best places of them are the frontal lobe, so frontal lobe epilepsy and frontal lobe seizures, and the temporal lobe. And this is because of the connection between the vagus nerve and the midbrain and the thalamus and the frontal and temporal lobes. But it does work for other types of seizures, and recently it is also approved for generalized seizures and generalized tonic-clonic seizures and generalized epilepsy, and even there is evidence for Lennox-Gastaut syndrome and those secondary generalized epilepsy. So pretty much all seizure types and all causes of epilepsy can benefit from vagus nerve stimulation. There are some worries about vagus nerve stimulation in some conditions that might not be the best candidate, which are the patients who have cardiac conduction issues, which means that there is some problems with the electricity in the heart, because we implant the vagus nerve that is controlling the heart to some part. Luckily, the right vagus nerve goes directly to the heart and controls all the heart rhythm, and the left one is not very much involved in the heart, though it can have some effects on the heart. So that is a consideration. So if you have cardiac issues or electricity problem in the heart, you consult with your doctor if vagus nerve is safe for you. I have patients who have even pacemaker that they got vagus nerve stimulation and it is working well for them. And the other condition that we worry about with vagus nerve stimulation is obstructive sleep apnea, because the vagus nerve controls the throat and the airway. So if we have obstructive sleep apnea, which is an obstruction in the breathing and in the airway, vagus nerve stimulation might worsen the obstructive sleep apnea. And I have cases that was well reported that VNS can worsen their sleep apnea. Now, luckily, we have advanced programming capabilities that we can program the device to go off during the day and decrease the setting during the night. And we also have other parameters that we can modulate, and we can program the device so that it can be safely given for patients with obstructive sleep apnea. So it is not a contraindication, it means like completely not able to do it, but we just worry about this condition when we are deciding on vagus nerve stimulation. If you have any questions about VNS or any other treatment of epilepsy, I go live multiple times, and make sure you subscribe and hit the notification bell so that whenever I go live, I will answer all your questions and you get to ask your questions. And the other thing is that comments on the videos. So the last video I publish, always I will kind of interact in the comments mostly during the day of publishing, so make sure you comment there. And if you want to get a direct consultation with me to go over your case and tell you what is the best treatment and can become and be treated by me personally, you can contact my hospital hospital and get the consultation. I will leave all the information in the description of this video. How is the VNS procedure done? VNS procedure is a very straightforward and relatively a simple procedure. We call it minimally invasive, which is not going into the brain. It will be safe in the neck, and we will put a wire around the vagus nerve, and this is how the wire looks like in real life. And we put it around the vagus nerve, and then we'll thread the wire under the skin and put it connected to the generator or the battery under the left clavicle. And we use the left side, as we explained, that the left has much less control over the heart, so it will go to the brain and will not have lots of side effects on the heart. The doctors who will implant this are mostly neurosurgeons. We now have a functional neurosurgeon specialized in epilepsy surgery, but other doctors so I've seen some like cardiovascular surgeons or ENT doctors, they can put this device, but we prefer to be treated by a neurologist and a neurosurgeon who is specialized in epilepsy, because it's a treatment decision rather than just putting in a device. The procedure have complications like any surgical procedure, but luckily the complication rates are very low, between 1 and 5%. The complications can be nerve damage, which is extremely rare, especially in the experienced hands. It can be some infection, bleeding, migration of the device, which movement of the device with time, but the surgeons try to kind of connect it very well so it does not move, and some complications of the anesthesia itself and doing the procedure. But overall, it's an outpatient same-day surgery. You will come to the hospital in the morning, get this device, go home in the same day. So it's relatively a very simple procedure to be done. And most of the complications, if happen, either can be treated or they can be reversible. There are other complications on the long term. We will talk about them in the next section. How does the VNS work? The exact mechanism of how the VNS will do its magic in controlling the seizure is still not fully understood. However, we know that because of the anatomy and the connections between the device and the brain and all of that, we know that the device is connected to the brainstem in the nucleus ceruleus and nucleus tractus solitarius. Those can be connected, and then it has pathways going to the thalamus, and from the thalamus it's a hub station. It goes all over the brain, mostly in the frontal and temporal lobe. So with those connections, the electricity will migrate throughout, and it will do modulation, and it will make the GABA inhibition much more effective and make the seizure electricity less in the brain. However, we're doing lots of studies to understand this better and find the exact parameters that work for seizures in the best way. What are the side effects of vagus nerve stimulation on the long term? We spoke about the surgical complications, but over the long term, the most common side effect that patients will complain about is hoarseness of voice, because the same nerve, the vagus nerve, controls the voice box and controls the vocal cords, and patients can have hoarseness of voice when they speak. They will have hoarseness of voice or something like that. There'll be hoarse of voice. Not all of the patients, depends on the time and the stimulation parameters. And usually the body gets used to the stimulation, and that hoarseness of voice will go away with time. However, if it does not go away and we go up higher in the stimulation and the hoarseness of voice will persist, we can do some modulation to change the parameters of stimulation, which can help a lot with the hoarseness of voice, which usually will decrease the pulse width, and we will decrease the stimulation frequency. I have patients who have like very bad hoarseness of voice. I just change the parameters of the pulse width and the vibration and the hertz of the frequency, and the hoarseness of voice went away completely. Other adverse events might be tingling in the throat, throat scratching sensation, cough, shortness of breath, and even like muscle pain and soreness from the device side, but also those might improve with time. What to do if VNS is bothering me? First of all, we should make sure that the VNS is the cause of your cough or the hoarseness of voice or whatever is going on, not you are contracting a flu or having another cough syndrome. So for this, we should know the parameters of the VNS. The VNS does not go off all the time. It is mostly programmed to go off for a certain period of time and be off for another period of time. So for example, most of the generic settings that we use is being on for 30 seconds and then be off for 5 minutes. So if the VNS is bothering you and you have this cough and tingly sensation for 30 seconds and it goes away completely and you're normal and then comes back, then it might be the VNS. But if it's happening all the time, then probably it is not the VNS, maybe you have something else, but you can be checked by your doctor. I always have my patients take a picture of their settings so that they know how long the VNS will be on and how long the VNS is off so that they can correlate and understand what is going on. Another trick I use for my patients is the magnet. So the magnet is we give to swipe over the VNS, and that will reset the device to deliver extra discharges in a case of emergency and a seizure. But whenever the magnet is in close proximity with the device, it will shut off the device completely. But it is safe. Whenever you take it off, it will kick back on. So what I do is that I ask the patient to stick the magnet to their device for some time. So I'll ask them to stick the magnet for like 10 minutes, 15 minutes. And if their cough and symptoms completely go away, then it is probably the VNS. If the cough continues, then probably it is not the VNS. So it's a way that we can troubleshoot the VNS at home without needing to come to be visited by the doctor. Can I remove the VNS if I don't want it anymore? The answer is yes. You can remove the VNS device if it is bothering you a lot, if it's not working at all, or if it is having an infection that is resistant. Yes, we can take it out, but we should know that the device itself can be removed, the generator, the wires can be removed, but the part that is wrapped around the nerve, as you can see, this device wraps around the nerve, so this can heal on top of the device, and it will be dangerous to rip out this device from the nerve, and it can cause nerve damage. So it is recommended to leave those 1 to 2 centimeters around the nerve, and it is safe to do so. We can even do MRI on top of that and with no problems. I have patients who explanted the device with no issues. How effective is VNS in controlling seizures? Well, this is the meat of the presentation. If we have a VNS, how much it will help my seizures, and what do I expect from getting the VNS? We should know that the VNS is a neuromodulation device, which means that it will modulate and help and build the anti-seizure effect over time. So the longer you have the VNS, the better you will experience improvement in seizures. It is expected that it will cut the seizure frequency by at least 50% in 50% of the cases, which means that you are expected to have a drop in your seizures by at least 50%, and this significantly improve with time to like 60, 70, and 80% over the coming years. And given that we did the optimization of the programming and we went up as much as possible so that we get the benefit from the VNS. The chances of complete seizure freedom means that you implant the device, seizures completely stop, is about 10%, give or take 5 plus or minus. It depends on the studies and the population. It is kind of not very homogeneous or the same population, some in kids, some in adults, and it depends on the background and type of seizures and so on. But overall, this is a ballpark expectation of the VNS making you seizure free. There are other benefits on VNS, and one of the most important benefit is the intensity of the seizure and the severity. For example, how strong the seizure will be when you have a seizure. I have a patient that she had this VNS, and then her seizures came down from like 3-4 minutes to 1 to 2 minutes, and the seizure does not impair her consciousness completely, and the post-ictal state completely improved and went from like 24 hours completely worn out. She's sleeping and could not do anything and could not take care of her children. Now she will have like 5 minutes, 10 minutes after the seizure, and she's completely back to herself, and she's so happy because of that exact recovery from the seizure. So it's not just the seizure frequency, also other things that help with quality of life. So everyone is completely different, and the goals of the treatment of this device are different from one person to another. And the other thing we should always mention is that epilepsy can cause death in patients, and it's called SUDEP, sudden unexpected death in epilepsy patients. So this is a disastrous complication that can happen, unfortunately, to people with epilepsy. We have a strong seizure that the brain will stop and the heart will stop, and they can die from this. And luckily, it is a rare complication to happen, 1 in 1,000, but it does happen, and we should always worry about it and give the right treatment. And studies have shown that SUDEP is less in patients who have vagus nerve stimulation. So literally it saves lives, and it can decrease the chances of you dying from epilepsy. And sometimes I'll ask my patients like, do you get any benefit from this device? Like, I did not get any benefits. It's the same. I did not even improve any inch. But the device will go down, and like the battery will die, and then all of a sudden they start having seizures right and left, and they go into status epilepticus. And we know retrospectively that the device was helping, but the only way that to know is that when the device dies, then the seizure came back. So it is different from every patient to another. And there are some cases that they have zero benefit from the VNS, but I would recommend to give it a try for 6 months to 1 year at least to make sure that you give it enough time to prove in itself it's beneficial or not. Will the VNS work right away? So that's an important question and expectation setting by the doctor and the patient. So we should know that the VNS is like any medication and treatment. It needs some time to build up in the system, and we need to reach up higher stimulation parameters for it to fight the electricity in the brain and the one that's causing seizures. The VNS is incremental. It goes up a little bit step by step, and we reach the parameters of the best ones is 1.5 to 1.75 milliampere, which is the amount of electricity that is needed and best to control the seizures. And this will be given over time. We used to bring patients every 2 weeks or 4 weeks to program the device, and some patients takes like a year or two until they reach the higher doses. But luckily now we have a new device, the Sentiva device, that has advanced programming, and you can from first day after the procedure, we can program the device to go on its own and keep increasing until it reaches up to 1.5, the target treatment dose, every 14, 21 or 28 days. So we decide how fast we go, but it is very possible now to get one session of programming that will increase on its own. And also I will have my patients take a picture of this advanced programming, and they know that, oh, in July 15, they will go to 1.3 or 1.25. In July 30, it will go to 1.7. All of that because they might like all of a sudden start having like, tingling in the throat or pain, and they look into the calendars like, yes, this is the day where it goes up higher and it is expected, and they deal with it. And it improves with time as well. So with this time, don't expect that the seizures will completely stop after doing the surgery. It does need a little bit of time, a few weeks, a few months, and we need to continue the medications the same after taking the device. Do I need to take medications after the VNS surgery? The answer is yes. You need to take your medications, all of them, after taking the VNS and putting in the VNS for after the surgery, and this is in collaboration with the VNS. So the medicine will work with the VNS, together will help your seizures. There are cases, yes, that if the seizures stop completely and got better with time, we can lower some of the medications, but you will continue to take medications after the VNS implantation. And it is very important not to stop your medications because that will worsen your seizures. How long does the battery last, and how do we change it? Well, luckily now with better devices, we have better battery and lifetime. Most of the batteries will last from 4 years up to 10 years. So most of the time, my patients the battery will last them about 6 or 7 years, or even longer. I have a patient that have been like 10 years with no need for even to change the battery. But it depends all about how much they use the device and what are the parameters and the duty cycle, how often the device is working. We have patients they're having severe epilepsy and they need lots of stimulation, so the battery will drain earlier than patients who have stable settings that they don't need lots of stimulation as well. The battery change is very easy, an outpatient procedure. The device itself is implanted and the wire is all the way to the chest. So what we do is just change the battery in the chest. We don't open the neck or anywhere. We just sometimes they do it with local anesthesia or some sedation. They will just do a small incision, take out the old device, put a new one, and that's it. So it is very, very well tolerated procedure. The risk of it is very, very minimal. So don't worry about changing the battery often. It's not like a battery charge like every 5 minutes. No, it is like it lasts for multiple years and it is not a problem to change the battery. And you get to have the newest and the latest model when you change the battery. Can I get scans and imaging after implanting the VNS? The answer is yes. VNS is compatible with CT scan, of course, like any metal devices are okay with CT scan, but they are also compatible with magnetic resonance imaging or MRI imaging. So you can get definitely MRI scans for the brain with the VNS device. However, we should know that with the VNS being in the chest, if we put coils right on top of the device, it can induce heating in the device. So we avoid imaging the neck, lower neck, like C5, 7, and T8, T1, all of that like area around the device. We should avoid that. But otherwise, the rest of the body and the brain can be imaged safely with VNS. However, we should always turn the VNS off before the MRI. So we have VNS programmers in all our MRI suites, and they will do it on on their own, or some centers, they are not comfortable with doing so, so they will come to the neurologist, turn off the VNS, go to the MRI scanner, they will do the MRI scan, and then the patient will come back to the clinic and turn on. But you should not turn off the device for a long time. Make sure that you arrange with a neurologist to do it on the same day. Can I travel and go through airport security with VNS? The answer is yes, you can travel safely with VNS. There is no issue with that. However, you should know that VNS can be interfered with, like it can be affecting their programming or the device with metal detection devices. So the metal detection gate, the wand for the metal detection, and the standing gates, all of them are not compatible with VNS. So what you should do is that tell the TSA or whoever the border agent that you have medical device. You don't have to disclose what is this device, why you're using it, or you have a card or anything. I mean, it's good to have a card if you want, but you don't have to disclose anything. Tell them that I have a medical device and I need padding exam. They will take you to a private room. They will do a padding exam, and that's it. But make sure that even if they want to use metal detector, to use it on your body, but do not get it close to the device. This is a no-go area. Remember, with no metal detection devices or gates or any of that, those devices. Do I have to have an aura or warning before my seizures to have VNS implanted? And the answer is no. Yes, the VNS can have a magnet that you can use in emergencies. If you feel the seizure, if you feel the aura, yes, you can take the magnet and swipe it, and that will help to give extra discharge in the hope that it will stop the seizure. And I have many patients that they do that, and it helps their seizures. However, we should not have auras for implantation of VNS. VNS can be done with no auras, and it's fine. And we have now smart settings in the VNS. It will detect the heart. So because it's in close proximity, we have now VNSs that all of them have heart detection monitor. So it will monitor your heart rate. And if there is a seizure, usually the heart rate will increase in about 80% of seizures. So that will be set up to be detected, and it will give extra discharges on its own without you even interfering. But if you do have a VNS magnet, you can use it. And other caregivers, they can use the magnet also to swipe. You can swipe it only once. You don't have to keep swiping it every 5 minutes, because once you swipe it, it will give extra discharges for a whole minute. Assuming that the device was off during that time, remember 5 minutes off, 30 seconds on, then it will help to stop the seizures in some cases. Can I be tracked, or will somebody control me through the VNS? The answer is no. VNS cannot be tracked. It's a very low technology in terms of like controlling the mind and everything. It's just an electricity that is connected to the neck. The only way you can interfere with the device is you have a programmer that we have in our clinics, that we will put the programmer on top of the VNS and we do the programming. Otherwise, there's no one can access your VNS, and it is low technology in terms of like controlling the mind. It's not going to go to the brain or anything, and we don't have any technology that can interfere with the mind right now. So don't worry about this. Can my iPhone affect the VNS? The answer is maybe. So we have studies that showed that the newer models of iPhone that have the magnetic fields around them, iPhone 12 and 13, they do have magnetic field and they can interfere with pacemakers. And we have a study at Henry Ford Hospital where I work that we showed that it does interfere with the pacemaker, and we should not put the device like in your pocket or somewhere around the device. So in extrapolation, I think that it might also affect the VNS. So it is better to not put your iPhone that has this magnetic proximity system in close proximity with your VNS, and it can be affecting the device. But also make sure that the VNS magnet is a very strong or powerful magnet, so do not put it in close proximity with any devices, not laptop or phones or anywhere. Make sure they don't put the phone in the same pocket with the VNS magnet, because it can literally fry that phone and can damage all the circuit, because it's a very powerful magnet. What about TVNS? So TVNS, or is called transcutaneous VNS, which is a device now that is using to stimulate the auricular branch of the vagus nerve stimulation through stimulating the external ear. So we have a stimulation that goes into the outside of the ear, and that will provide stimulation, and then hopefully it will go to the vagus nerve and then go to the brain and help with seizures. This one is not mainstream. However, there are multiple new studies and being tested that showed promising results in epilepsy and the epilepsy treatment. We need more studies to understand this better. It is approved in Europe, but in the United States it's yet not approved. US will have like very stringent parameters for approval. So unless it's very effective, they will not approve it. But studies are undergoing and there are some promising treatment effects. So we might see VNS in the future, who knows? And it is a very good choice because it is not invasive, but we have to prove that it is even helpful. Some cases were short term, it was helpful, but we don't know on the long term and years after. So ask your doctor if VNS is good for you. And whatever happens, you should not leave seizures untreated or poorly managed, because seizures get worse with time, and every time every seizure brings the next seizure, So you want to make sure that we do everything we can to control the seizures for better outcome. What is the cost of VNS, and will it be available in my country? Well, the cost of VNS surgery cannot be estimated generically for everybody. It depends so much on the insurance coverage, on the country of residence, the cost of surgery, the cost of the device itself. The company will sell those devices with different prices for every country and every location in the world. So for you to know exactly what is the price for this device and how much the cost of the surgery, you need to ask your neurologist or neurosurgeon what is the exact cost of this device in my country and if they can order it. And this device is relatively very easy to use and understand. So any neurosurgeon has experience in nerve surgery, they can be able to do that device. And if you need help, I will be able to help you getting those devices and training of the neurosurgeons in your country. We think of VNS now as one of many devices that are good for epilepsy treatment and multiple surgeries for drug-resistant epilepsy. And we should always know what is the device and what is the surgery type that is best for the patient. And to know all about different devices, about epilepsy surgery, and how we can treat those drug-resistant epilepsy, you can see this video that I explained all the different treatments for the resistant epilepsy to learn all about them and see the actual devices, and stay healthy, and see you in the next one. Salam.